Okay. Hey, everybody. Today we are going to be talking about how to graduate our clients and our patients from physical therapy and on so you know what to do and how to handle it. My name is Shelby Blankenship. I'm one of your TAs and a physical therapist with the MMOA division, and we are going to go ahead and get started. So, I wanted to give you guys a couple of ideas of what to do. I know it's super hard and frustrating when you get repeat patients or clients because they do really well with you and you feel like you're finally getting to them. They're getting strong and better, and then you discharge them. And then 3 to 6 months later, they show back up with the exact same issues. I think the majority of our clients, they tend to get discharged. They might keep up with their home exercise program for maybe a week or two, and then they slowly start to peter off. Um, Most of the time, it's that lack of accountability, whether it's with us or a group or a community that they can get involved in. So, I wanted to give you guys a couple of ideas of how you could do that. A lot of these are online, some of these are in person. So, whatever works for your client, we have options. The first one that I wanted to talk about is actually Peloton. So, I use the Peloton bike, but you actually don't have to have a bike or any of the equipment to use their stuff. You just need the Peloton app. It's $12.99 a month, and I'm pretty sure the first 30 days, like everything is free to just try. There is a coach. His name is Logan Aldridge, and he is a part of another program that I'll tell you about in just a second. But he has a upper extremity amputation, and he actually teaches programming and classes for people who have upper extremity, lower extremity impairments, whether it's you're a standing athlete or a seated athlete. They have programming for both. Usually it's a 1 week program where they have 6 days of things that you do each day. And then it can range from, 10 minutes to 30 minutes. And you kind of unlock each of the workouts, and then they progress you in the programming. That way, people are actually progressing and not having something that's way too difficult or anything like that, which is really cool. And I really like how they have both for seated athletes and for people who can stand. And he puts all type of adaptations in his workouts. He's doing push-ups, he's doing wall walks, he's doing all kinds of cool stuff. So that could be not only for your older adults, but people who might be a little bit younger and are really wanting to get back into that athletic gym life. So I just want to give you that's one. The second one is the Adaptive Training Academy. So he actually teaches with them, and he helps create this adaptive and inclusive training certificate. So my husband actually has that. We at Stave Off, we have, we pretty much see all older adults, but we actually have a specific category just for adaptive training. So people who've had TBI, spinal cord injury, any type of issue where adaptive equipment or adaptive just programming is required. So that is a great certification to have, not only as um, a therapist, but also if you're curious of who else is out there that has that certification. There's tons of people and there's tons of affiliates that where you could program, hey, like at discharge for my client, we're going to be able to do this, and then you're going to move on to this, programming with this affiliate. Just kind of gives them another avenue for a community, and they've got such cool like people that are around, like all kinds of athletes, whether you're seated, not seated, have a neuromuscular issue, whatever. It's super cool, and they've got a really large community, and it continues to grow. They do both live and online certifications if that's something that you're interested in. But it's just cool to link up with somebody who has that. And then there's also wheel wad programming. So it's kind of going down the trajectory. Wheel wad programming is what we actually use at Stave Off for our programming for our 50 and up fitness classes, but we also use it for our adaptive athletes. It's really cool because it has it broken out into impairments that people might have, whether it's standing or seated, and it has a full workout so that everybody's doing the same workout. which is really nice. And then you can also alter it, like rep scheme and those kinds of things. If like there's like handstand push-ups, most of my older adults are probably not going to get to that point, and so you can just alter things based on that. But it's nice to have a good base, especially for some of your older adults or your adaptive athletes that are really interested in like getting into a more consistent programming. It's not very expensive, honestly, and it's really thoroughly done. And they do videos and kind of give you some ideas of adaptive equipment that you could use. That's another thing that they do with the Adaptive Training Academy. They have like a whole list of adaptive equipment that people could use. So instead of using like a jump rope, like that we would normally use, they have adaptations for people who are seated, where it's like two different jump ropes and that you practice. And then there's one where it's just one for somebody who has like an amputation on their upper extremity or can't use it. And then it's a jump rope where they just use one hand, which is pretty cool. So they have access to all those vendors, and you can kind of get lined up with, who would be the most appropriate for your clientele. Another one I wanted to talk about, I know Sam has talked about this before, but Mayhem Athlete has like a walking program that's free that you can download and actually put like little notes of, hey, this day we're going to do walking, and then we're also going to add in like a 5-minute AMRAP to work on deadlifting or, whatever. And that way you have like a printout, and then they can make notes on the side, or you make notes on the side of what they could do. And then it kind of slowly progresses them from a like 5-minute, I believe it's every other day, to a 5-minute every day, and trying to progress their walking as far as speed or hills or anything like that. And then you can progress them to doing, maybe it's Mayhem 30 or Mayhem 60, or things with minimal equipment or a lot of equipment. Just kind of depends on what they're looking for and what you think is appropriate for them, but at least gives them a framework to get started. And then the other one I wanted to mention is that a lot of CrossFit gyms are actually starting masters classes. Some of them, sometimes they're called like legends, or something like that. It always has a cool name. But it's just like masters athletes, so usually 50 and up. And it allows a lot of that group to get a nice community and get some coaching and just have a place to go that they're getting really sound coaching while also getting that heart rate up. They're working on things that you've probably already been working on with them, as far as deadlifts and squatting and all those kinds of things, which is super cool. And then the last thing I forgot to mention with the Peloton app is, even though it's notoriously known for its cycling, they have yoga, they have bar, they have running and walking indoors and outdoors. And then, of course, they have like the boot camp strength core classes. So if you have a client who's not really sure, like if CrossFit is something that they're really into, or they kind of like trying all different kinds of things, that would be a kind of nice segue, and it's not super expensive, and they can do it from anywhere. Most of the time it's very minimal equipment. They could, if they travel for work, they could do it in their hotel. If they just have like a home gym or no gym at all and they just need to do it in their house, they have all that, and they have ways to filter as far as time and the type of um, aggressiveness, I guess you could say, in the classes, and then just, of course, like the type of class. So I just wanted to give you guys a couple of insights of things that we've used. They've been super, super helpful. I'll make a list of those in the comments so that you can have those to refresh your memory in case you ever want to try that with anybody. But I also highly recommend checking out anything local to you, your senior center. Any of their like inpatient rehabs that have connections to like next steps. Definitely get in with those guys so that you can have the best idea of what is out there for your clientele, so that either a one, you can try it yourself and see if it's actually as aggressive as they as you think would be appropriate, or just to see if it's any good and have that connection. And that's always really nice when therapists or show that initiation with their community to see like, hey, this is something cool that we want to offer, or see what the patients could actually see when they go and try it. So I just wanted to give you guys a heads up on those things. And then we have a live class this weekend in Aiken, South Carolina. And then I will be with Julie in, I believe it's Oviedo, but I'm not sure if that's exactly how you say it, in Florida the next weekend. And then there's another one also that weekend, April 22nd, 23rd in Rogers, Arkansas. If you're wanting to do essential foundations, we have a class coming April 26th. And then advanced concepts is starting May 4th. So make sure to sign up for those if you're interested. And other than that, I will put the list of that resources in the comment section, both on YouTube and on Instagram. So if you want to check those out, you absolutely can. And hope y'all have a great rest of your day. See ya.